This is Claire. She is a 68-year-old single mother who has worked as a stockbroker for most of her life. To deal with her stressful job, Claire smokes and has a high-sodium diet with most of her meals being fast food. This has resulted in her becoming obese and being diagnosed with type 2 diabetes. Due to headaches, chest pains and dizziness, Claire was rushed to the hospital where she was diagnosed with acute pulmonary edema. Claire knew that her maternal grandmother and mother had a history of high blood pressure and congestive heart failure. Hence, it would make sense if Claire also had these medical conditions. Some tests were conducted to see if Claire also shared these medical conditions. The test results indicated that Claire also had moderate hypertension as well as congestive heart failure. Oh no! Claire was then referred to a doctor to discuss potential medication treatments for her symptoms.
Claire was prescribed thiazide diuretics for her moderate hypertension, along with angiotensin II receptor antagonists. Diuretics function by inhibiting sodium reabsorption by the kidneys. The sodium subsequently has co-absorption with H2O, resulting in more fluid output, leading to a decrease in blood volume and therefore blood pressure. This occurs in the early segments of the distal tubule, where sodium reabsorption occurs. This is primarily used to clear edema and sustain normal blood volume. Claire's doctor prescribed her with a thiazide diuretic known as hydrochlorothiazide, common brand name being Microzide. The doctor advised her to take one 25mg pill per day. Microzide falls under Schedule 4 in the TGA drug scheduling. Being a Schedule 4 drug, it's a prescription-only medicine. Its pregnancy classification is Category D, as it acts on the renin-angiotensin system and can cause fetal morbidity and fetal death when administered to pregnant individuals. Hydrochlorothiazide has a bioavailability of 50 to 80%, with peak plasma concentrations at 1 to 2.5 hours after ingestion. 68% of this is protein bound with a distribution of 0.83 to 1.14 litres per kilogram. The mean plasma half-life of this drug is 5 to 15 hours. Hydrochlorothiazide acts to increase plasma renin activity, increase aldosterone secretion, and decrease serum potassium levels. Hydrochlorothiazide does not provide sufficient blood pressure lowering effects when used by itself. However, its combination with angiotensin II receptor antagonist results in greater decrease in blood pressure. Additionally, the two work synergistically in preventing each other's adverse effects compared to using the drug solely. Other adverse effects mitigated by the use of these antagonists are elevated levels of uric acid, lipids, and blood glucose levels. These antagonists additionally exist to inhibit aldosterone release and vasoconstriction, effectively reducing total peripheral resistance and sodium retention. Thiazide diuretics cause a decreased blood level of anti-diabetic drugs. Claire, being a diabetic, may therefore need to increase her doses of anti-diabetic drugs to compensate. The overall effect of this treatment is lower blood pressure, but side effects may exist and include hyperkalemia, with symptoms being abnormal heart rhythms, constipation, fatigue, muscle damage, and muscle weakness or spasms. Additionally, hyperuricemia and hyperglycemia. Conclusively, it should be noted that high doses of thiazide diuretics can also increase total blood cholesterol, triglycerides, and low-density lipoproteins. This incidentally increases the risk of cardiovascular disease. In summary, Claire has been able to lower her blood pressure thanks to thiazide diuretics and angiotensin II receptor antagonists. Her overall peripheral resistance has decreased as sodium reabsorption via the kidneys was inhibited, and water following solute results in more fluid output, leading to a decrease in blood pressure. Although Claire may experience side effects, these are expected and can be monitored accordingly. This drug has boosted Claire's quality of life and enables her to live a more fulfilling and happier life with her children.